Gastrointestinal complication of granulomatosis with polyangiitis. Definition: Granulomatosis with polyangiitis, also known as Wegener granulomatosis, is a rare disease. It is a type of vasculitis or inflammation of the blood vessels. The inflammation limits the flow of blood to important organs, causing damage. It can affect any organ, but it mainly affects the sinuses, nose, trachea, lungs, and kidneys. Symptoms may include joint pain, weakness, tiredness, cold, symptoms such as a runny nose that doesn't get better.
It begins with a process known as apoptosis, or programmed cell death. This process occurs in all multicellular organisms and essentially involves cells destroying themselves in order to facilitate various biological changes throughout the body. However, sometimes this process is ineffective and fails to remove the tiny fragments that are produced during the destruction of a cell. These fragments merge into compounds and are released into the bloodstream, exposing the immune system to substances that are normally found inside cells. The compounds that form are known as anti-neutrophil cytoplasm antibodies, or ANCAs for short. And unlike normal antibodies, these target harmless proteins produced by the body. The major target for ANCAs is the protein known as proteinase 3, which is the serine protease enzyme found in white blood cells. The release of this enzyme results in the acute inflammation of blood vessels known as vasculitis, which it achieves by inactivating anti-inflammatory granulin. The inflammation reduces the amount of oxygen in the blood and restricts blood flow to the organs supplied by these inflamed vessels, preventing them from receiving enough blood to function effectively and resulting in the destruction of tissue. The primary organ system affected by the disease is what is known as the upper respiratory tract, which refers to the airway above the glottis or vocal cords. Those affected can experience moderate to extreme sinus pain and nose bleeding, as well as the appearance of nasal ulcers. One of the most common indications of the onset of Wegener's granulomatosis is persistent rhinorrhea, which refers to the cold symptoms of constant nasal discharge resulting from nasal inflammation. Holes can then develop in the nasal septum, and this may lead to a collapse of the nasal bridge, causing facial deformity. Blockage of the auditory tube may result in severe infections and permanent hearing loss. Loss of vision, and what are known as pseudotumors, can form in the eyes, as well as a range of other infections including scleritis, conjunctivitis,
Gastrointestinal complications are abdominal pain, hematemesis, bloody feces, hemorrhagic bowel segment just distal to the ligament of Treitz, hemoperitoneum, and splenic vasculitis. Issue applied in Ecuador. The most common diagnosis method for Wegener granulomatosis in Ecuador is by determination of anti-neutrophil cytoplasmic antibodies, but positivity is not conclusive and negative ANCAs are not sufficient to reject the diagnosis.
Wegener granulomatosis is the topic for this video, and the interesting new name given to this disease is granulomatosis with polyangiitis. It's called anti-neutrophil cytoplasmic antibodies. They're antibodies that cause damage, and abbreviated ANCA. So I just wanted to quickly mention that before I erase everything. Okay, so let's get started. Now, what part of the body is able to really explain it without confusing somebody in a presentation? So I think the best way is to break it down into three main areas and then go from there. And these are the three main areas. You have the upper respiratory tract, the lower respiratory tract, and the kidney. Lungs, and we've got the kidney. But what exactly is happening to the sinuses, lungs, and kidneys? Well, what's happening is inflammation and tissue necrosis. So why is this happening? Well, because there is an autoantibody that I briefly mentioned, and that is responsible for all this havoc, all this inflammation and destruction of your own tissue in various parts of the body. Autoantibodies. Antibodies are usually very good. They help us, but if it's an autoantibody, then it destroys our own tissues in various parts of the body. Now let's get into symptoms. So instead of just hitting you hard with a whole bunch of symptoms, which would be a terrible way of describing this medical condition, let's break it down into lower respiratory tract, upper respiratory tract, and kidney. And let's just leave it at that. And that would be a much better way of describing this. So upper respiratory tract, you can get epistaxis, which is bleeding from the nose. You can get recurrent sinusitis. And those are some of the key clinical vignette symptoms that you will see on licensing exams. Lower respiratory tract involving the lungs, shortness of breath, symptoms such as cough and coughing of blood, hemoptysis. And then kidney, hematuria, and then kidney-related symptoms such as edema and high blood pressure, hypertension. Hypertension is more of a physical exam finding on.
Conclusion. Wegener's disease is unknown cause, although bacteria and virus, as well as genetics, has been implicated in its pathogenesis. If it's not treated in time, it can complicate vital organs and not performing their functions properly. However, there are many pharmacological treatments to help control the symptoms and prevent the disease from progressing and also improve the quality of life of the patient.